Hello everyone, this is Sarita Sharma, and today I'm going to talk about this case study where the patient is presented with pyruvate dehydrogenase deficiency. I chose this case from my patient list, and I decided to research on this topic because I thought that um, this was an interesting case. And moreover, this pyruvate dehydrogenase deficiency is a very rare genetic disorder. So the prevalence is not known because there had not been as many studies conducted or as many surveys conducted on this topic. So the prevalence is not known, but the assumption is that it's a 1 in 50,000. Let's start talking about it now. So for the patient overview or my case, this is a 35-year-old female with pre-medical history of some cardiovascular diseases and multiple TIAs. She has a mitochondrial disorder and pyruvate dehydrogenase deficiency. And then she has a degenerative disc disease, depression, seizure disorder, and epilepsy. So for today's presentation, the focus is on pyruvate dehydrogenase deficiency. Then history of present illness. The patient was admitted due to functional status decline, subtle mental status change, and new involuntary movements. So this was happening 2 months prior to the acute care admission, and the family said that there was the cognitive decline, there was the mental status change in the patient. So, not 2 months, sorry, 3 months before her admission to acute care. And per medical team, the current symptoms, along with other symptoms, so weakness and failure to thrive, was because of the pyruvate dehydrogenase deficiency and spasticity. So, with spasticity, I mean that the patient had new involuntary muscle movements, and because of these involuntary muscle movements, the patient had an increased need for energy and protein. So, so then how the patient came to us was so after the acute care, the patient was admitted to the long-term care. And because that's my facility, I work at a long-term care facility. So the patient came here for rehab after the patient was stable at acute care. So later on, the family contacted you to know if there is any nutritional modification that we can do to help patient maintain a nutrition quality of life and maintain or gain weight. So when the nutritional history was taken, so that is the first step in the nutrition care process. So the patient could eat, even though the patient had limited PO intake, but the patient was able to eat, chew, and swallow. And patient lost 23 pounds over a short period of time. So that was because of the limited PO intake and the increased involuntary muscle movement, or we can say the progression of the disease. The patient's BMI was 19.2, which was lower end of a healthy weight for height. So before we could recommend any nutritional intervention for this patient, it was very important to understand the disease physiology. So on research, we found that, and again, like I had to go back to the um, Krebs cycle, citric acid cycle physiology to understand how pyruvate is metabolized in the body. So what happens is during the process of glycolysis, um, the end product here is pyruvate. And before pyruvate goes into the mitochondrial cycle, where it produces ATP. Pyruvate is converted to acetyl-CoA, and then acetyl-CoA gets into mitochondria and produces energy, or enters the Krebs cycle in mitochondria and produces ATP. So here, this is the pyruvate dehydrogenase complex, and this pyruvate dehydrogenase complex converts pyruvate into acetyl-CoA. And this second figure here is in case of pyruvate dehydrogenase deficiency. What happens is that this conversion of pyruvate to acetyl-CoA is interrupted. So there is not enough acetyl-CoA to get into mitochondria, to get into citric acid cycle and produce ATP. What happens instead is that pyruvate produces this alternative byproduct called lactate. And what happens in the patient is the lactate accumulates and causes lactic acidosis. So there are two harmful things happen here. First is that pyruvate is not converted into acetyl-CoA, so the energy production is inhibited. And second, the pyruvate is converted into lactic acid, which causes lactic acidosis. So what happens when you have lactic acidosis? Due to lactic acidosis, you have these symptoms like the patient feels nauseous, vomiting, severe breathing problems because of the blood pH going down, and abnormal heartbeat. In addition to that, there is a progressive neurological and neuromuscular degeneration leading to delayed development of mental abilities and motor skills, intellectual disability, seizures, weak muscle tone, poor coordination, and difficulty walking. And then furthermore, research says that if a patient is diagnosed during childhood, then like the patient can survive to adulthood but have neurological symptoms. But if the patient is, if the disease onset is during the prenatal or in infancy, then it's like a death sentence. So it's hard to that the patient survives up to the adulthood. So in my patient here, even though the patient was diagnosed when the patient was a baby, like in early childhood, the patient survived up to 35 years. Probably, like I am assuming that it's because of the better medical care available, better understanding of the disease, and better nutritional care available to the patient. So for this, the research question was, could ketogenic diet help gain weight in a patient with pyruvate dehydrogenase deficiency? And the rationale to find an association between the ketogenic diet and the pyruvate dehydrogenase deficiency was that, as I showed in the slide, that the pyruvate is the one that is used. It's like a byproduct of glycolysis, and then the pyruvate is converted into acetyl-CoA, and the acetyl-CoA enters and produces ATP in mitochondria. So that cycle is interrupted. And when the patient is not able to metabolize carbs, and that's why probably the patient is not meeting the energy needs and the patient is losing weight. So if we can have an alternate energy source, that might help patient with maintaining a nutrition quality of life and gain weight. So that was the rationale for choosing ketogenic diet. And then ketogenic diet is high fat, which is the alternate source, and low in carb, and the patient is not able to metabolize carb that well. So probably ketogenic diet, high fat diet might help this patient. So that was the rationale to choose to do research on this topic. So then in the PICO format, the problem was that the patient was with pyruvate dehydrogenase deficiency, and the intervention was ketogenic diet, and comparable to typical American diet, and the outcome was weight gain or maintaining the nutrition quality of life. And the search terms based on this PICO, the search terms used were pyruvate dehydrogenase deficiency, because that was the focus, and ketogenic diet, of course, that was the focus of this research. And then I also added if ketogenic diet can help with the weight gain. So pyruvate dehydrogenase deficiency, ketogenic diet, nutrition quality, or weight gain were the search terms. So I found this study conducted by Sofu et al. And the research was the ketogenic diet in pyruvate dehydrogenase complex deficiency, short and long-term outcomes. So this is the study I used. Then the background was that the patient that pyruvate dehydrogenase is a rare autosomal recessive disease. Prevalence rate is not known because it is not that common. It's rare. So there are not as many studies available or surveys available. Then there is no treatment for this disease. And then the patient may benefit from maintaining a ketogenic diet and taking anti-epileptic drugs to prevent seizures. And my patient is already on anti-epileptic drugs. Then for this patient, there are some types of ketogenic diets. It's classic ketogenic diet where the ratio is 4:1, for fat and then 1 for carb. So that's the ratio for fat to carb ratio, 4:1 or 3:1. And then there is another one. I think it was modified Atkins ketogenic diet that we did not use for this patient. So yeah, for this study, they used a classic ketogenic diet. The ratio used was 3:1 because that is for children and adolescents. So then the study overview and methods. This was a longitudinal cohort study. The participant size was low, 19 pediatric patients with onset of pyruvate dehydrogenase deficiency, and they were all children. So all of them were less than 18 years of age, and all patients were getting treatment with ketogenic diet for 3 or more months. And then patient population was prospectively evaluated. So this was also a prospective study, and the data was some of the data was collected retrospectively in the studies. So yeah, and then the patients were followed, and they were evaluated at baseline, 3 months, 6 months, and 12 months period. And then data was collected retrospectively, as I just said. So for results, as we can see here, this table shows here the participants and their age. And this was the ketogenic diet ratio. So they slowly progressed. They started at a lower ratio. So like for 2 years, 7 months, they started at a ratio of 1:1, and then they moved up to 5:1. And then this 10.9 was the total amount of carbs that the patient was getting in a day. And then these are the calories. So they calculated the calories based on the body weight. And this data here was useful. So here they measured the lactic acidosis. So see, initially at the beginning of the ketogenic diet, it was 11, and at the last follow-up, it reduced to 1. And this last column here shows the cognitive symptoms. And for this one patient, it got worse. But for other, like all the rest of the age groups, there were improvement in the cognitive functions. And here, for all the patient groups, this table shows that the ketogenic diet ratio, like how much they started with, and then how they progressed to like how much fat and carb the patient was getting. And then even like here, when you look at this column for lactate accumulation, there was improvement in all the groups. So like from 4 to 1.9, from 4.7 to 3.5. So there had been improvements in all the groups. And then this table here shows that if there was any improvement in the motor, cognitive, social, and epileptic episodes. And this sky blue line, the light color line here, shows much improved. So again, in all the patient groups, there was a good amount of improvement in all these four outcomes here. Okay, and so the conclusion based on the study, so study concluded that with compliance to ketogenic diet, pediatric patients had improved lactic acidosis, had improved neuromotor, social, cognitive, and epilepsy-related episodes. So, so that was the study conclusion. So for when I analyzed the study closely, this is what like my understanding of the study is. So I decided that the data and the conclusion from this study is not applicable to my patient because there are many limitations in the study. First of all, the patient population is not same as my patient. So in this study, the patient population was less than 18 years old, and my patient is 35 years old. Second, the study did not evaluate the relationship between ketogenic diet and nutritional quality or weight gain. So this study um, analyzed all these different outcomes, but none of them was related to the nutritional intake or weight gain. So again, totally different outcome than what I am looking for. And then I think this was like really set me off. This part here, this statistical analysis was not done. So for all the outcomes, they were just saying that minimally improved or much improved or most improved, but there was no p-value evaluated. So we don't know if the results were significantly different or not, if the outcomes were significantly improved or not. And then there was no confidence interval or hazard ratio calculated. So like if there is no confidence interval, then how would we even know if the data is applicable to the general population? So for that, because of all these drawbacks or the study not meeting my needs, I gave a value of C to this study, and I decided that I am not going to use the study results for my patient here. And yeah, so that's it. And these are my references. And thank you so much for being with me.